Hey guys, this is Greg McKettrick. I am the Men's Health Clinical Liaison for Revelation Pharma, and this month's presentation is on oral testosterone therapy for men. This is our disclaimer page. You can read at your leisure. So, in terms of what I'm trying to try and cover in this presentation, just kind of the background and history, origination of testosterone, the concepts, the pros and cons of oral testosterone, and clinical use. Pretty simple, pretty much the same as what we're using any other TRT for, but we'll include that. And then the options in terms of the different oral testosterone forms and products. What makes a good candidate? Why would one person select oral testosterone over the other options? A little bit about the cost, the economics, and then compounding with oral testosterone. So here's some fun facts. Going way back to the 21st century BC, there is documentation of the ancient Greeks and Romans actually using castration to create eunuch slaves. So that's a long time ago. And then moving forward into Chinese history, into like the 1300th century BC, 1300 BC, sorry. Same kind of a thing. And using the castration, they actually did that with soldiers, harem guards, which makes sense, and wealthy Chinese women would have eunuchs or castrated men as sexual companions, because it didn't bring a problem as far as pregnancy. So, this really does illustrate the understanding of testosterone or testicular function and fertility that went way, way back. Moving forward, from there, this activity kind of led to that next step, which was really the consumption of animal testes and testicular extracts to promote strength and fertility. So here's your earliest examples of oral testosterone. Back into the 1600s, we started seeing scientists explore the actual physiology, the structures of the testicles, looking into the functions, and even doing species where they would implant testes into animals to see if they could stimulate the sexual function. Jumping way ahead now into the 1930s, we have the actual discovery of the first androgenic steroid, androsterone, and that was isolated from men's urine. And then 1935, testosterone was extracted from bull testes. So literally actually being able to isolate and extract it. And then the first studies followed, illustrating the chemical synthesis of testosterone. So that really is, you talk about a long time frame, but the remarkable timeline, it goes way back, and it's the introduction into what we know today in terms of testosterone and the endocrine system and the reproductive system. Pretty fantastic. Testosterone pellets and injections really came to life in the 1930s. In addition to that, in 1935, there was the first real oral testosterone form. It was a synthesized alpha-methyl testosterone, and it proved to be effective. But what they found in actual application was that it was very hepatotoxic, so causing a lot of damage to the liver. And because of that, there was probably will be going forward, a strong stigma against oral testosterone within the medical community. Um, but again, more research continued. So, methyl testosterone came out in 1936, which still around. It was marketed under various trade names: Android, Testosterone, fluoxymesterone. Again, been around since the 1950s, still around, and not used all that much, but it's still in existence. And then, what we saw over the course of a couple of decades was really a very focused energy on androgen research, um, chemical structures, chemical modification, looking at the steroid molecules. Um, and so again, you kind of look at the introduction of when we first saw this, and then, you know, by 1956, there were actually 256 different androgenic steroids that were known and published. And then that number jumped over the next 20 years to over 1,000. So again, lots of research that went into this. The problem was with all of these, different androgens and the different compounds and the different isomers and all the rest, um, the effects of the testosterone were there. Obviously, they were getting the androgenic effects. The problem was that even though they could, maybe isolate and emphasize particular effects, they could not eliminate the negative effects. So you'd have particular compounds that were particularly good in terms of their androgenic effect, but they had significant negative effects, and they just couldn't get around it. So it was also determined that, not only did the first pass have a significant effect on the liver, but also that the oral testosterones were severely degraded passing through the gut. So brings us again into the 1970s, and we see the first oral introduction of testosterone undecanoate. Um, Now, there had been the injectable version used, and they knew it was effective. They knew it had long half-life, um, but they had not actually tried it in terms of an oral form. The research showed that, the oral form of testosterone undecanoate was beneficial because it didn't have that same liver impact. It was actually absorbed through the lymphatic system in the gut, um, which did two things. One, it protected the liver, but secondly, it protected and preserved the functionality. So you didn't get the same degradation of the compound passing through the gut. So kind of a twofold benefit. So what are our options in terms of oral testosterone today? Well, pretty simple. The number one choice is the testosterone undecanoate. By far the best in terms of the fact that it's functional and it has the least negative effects. And it comes as a variety of different strengths in different products. And you can see here probably the ones that are known the best are the Jitenzo and Tlando. Um, and you see kind of the dosage ranges here. So with Jitenzo, it comes as 158 milligram, 198 milligram, and 237 milligram. And depending on patient's response and what their levels are, anywhere from using the 158 milligrams twice a day up to um, really almost 400 milligrams twice a day using the combination of the two of the 198s. That's the highest recommended dose. Um, what I have seen in practice is that when physicians are not getting the optimal numbers that they want, or patients are not seeing the duration of effect that they want, they will at times use this on a 3 times a day dosage platform. Um, the testosterone products, they're very rapidly metabolized. So, minimally, you really don't see much of this on a daily dose. Although, as you can see under the McKettrick's, the version, they start their dosing at 100 milligrams once a day, and in reality, that's not commonly used. Um, Minimum dosage really is going to be 100 milligrams twice a day, and moving up to, again, as high as 400 milligrams twice a day. Um, like I said, just the oral form, it gets metabolized relatively quickly, so once a day dosing is not practical. With Tlando, same type of a thing. You see your dosage is just over 400 a day, 225 twice a day is their recommended dosage. And as I said, in all of these, you will at times see them used 3 times a day, even though that's not within the manufacturer dosage guidelines. So, benefits of oral testosterone. What are the good things here? Obviously, all the same benefits that you get from TRT, from testosterone replacement therapy. Significant improvements in terms of mental and physical capacity, improved muscle and body composition and bone composition. So bone density is improved, muscle mass is improved. Um, Significant improvements in energy and libido. It's cardioprotective or improves cardiac function, as well as cognitive function. You all hear about brain fog with hypotestosterone, and mood. Yeah, so it's really hugely beneficial, as are most forms of TRT. But specifically to oral testosterone, what are the things that are going to stand out in terms of patient counseling, or what you can offer as benefits for your patients? So ease of use, number one. It's a capsule or a tablet. So easy to take. Storage is not an issue, so no refrigeration. Uh, it's easy to transport. It's easy to move around with, so you don't need to take a cooler with you. Convenient dosage forms. One of the big things with other forms of testosterone, like a topical, you have the issues of transference. So, people who don't like injections, a lot of times their go-to route of therapy is using a topical cream or gel, and then you have the issue there with transference to partners, to children, to pets. Um, so this avoids that. Probably the biggest benefit: no ouches, no needles. Um, Patients don't have to practice aseptic technique with this. You're not concerned about a multi-dose vial where you're going to contaminate the content or introduce contaminants to the vial. Again, simple dosage instructions because it's just taking a capsule a couple of times a day. And in general, most patients, you see significant improvement in adherence to therapy. As long as they're getting the benefits from it, there's not a whole lot of negatives. There are a variety of different dosage forms that we'll call oral. Of course, oral is primarily capsules and tablets, but I consider the sublinguals and even buccal systems oral. So on the downside, negatives of oral testosterone, or the cons, um, same side effects that any testosterone therapy can produce. So, acne, oily skin, fluid retention, changes in hemoglobin and hematocrit. You can get sleep apnea. Certainly, kind of reduction in actual testicular function, so atrophy of the testicular function in testicles. Uh, could lead to hair loss, and you can get mood changes, but again, don't see that too much more benefit than negative there. Um, Commonly associated with oral forms, especially the pills and tablet forms: upset stomach. Um, you do tend to see a significant amount of pruritus with this, which sometimes that is one factor that can cause patients to change the type of testosterone they want to use. Um, Changes in appetite, and again, as mentioned before, although we try to avoid the forms that are going to be more hepatotoxic, there's going to be some issues with that with most oral forms. Um, so that's going to be one of the big negatives. Uh, Far more serious with the oral, and again, the main products that we see currently are the methyl test and fluoxymesterone. So that's the principal reason those really have kind of fallen out of favor. Um, just the downside is more than what doctors and patients want to deal with. One negative, because again, any oral form, it's not a single daily dose kind of a thing, or a weekly injection or a 3-month pellet insertion. This is multiple doses a day. So that can certainly be a little bit more rigorous for patients and can cause some issues with compliance. The other thing, especially now we're talking primarily not the compounded, but the commercial products, these guys are pricey. Um, so, I kind of went through the list of the oral testosterone and decanoids, and for a month's supply, twice a day dosing, these things are over $1,000 a month. And the ones that have generics are still in that same price range. So unless somebody's insurance is covering it, man, this stuff is steep. Other options for oral forms of testosterone, again, we mentioned the buccal or sublingual, um, which are great because number one thing is they bypass first pass, so they're not being degraded in the gut, and it reduces the impact on the liver. One thing that I found that was really interesting, I had not heard of this before. It's a product that is no longer on the market, but um, I wouldn't say it's out of the realm of possibilities. It's called Strian, which was 30 milligram buccal system. So think of it as a kind of a patch that went on the gum line, upper cheek gum. Um, it adhered due to the moisture in the oral cavity and had a full 12-hour sustained release, which is really cool. Um, the negative here was that the system itself caused significant gum irritation. So that led to it being withdrawn from the market. Too many adverse effects, gum and mouth adverse reactions. So any potential system that would be like that would have to be addressed. Um, Other forms, the liquid. So testosterone in a sublingual solution or sublingual suspension. Um, Rapidly absorbed, rapidly metabolized. Negative here is that you're literally having to do this 3 or 4 times a day. So really tough for patients who want to use this for um, a good option for TRT, simply because it's just so rigorous of a dosage schedule. And then compounded sublingual troches. Um, these can be compounded in a variety of strengths. I have treated patients in terms of TRT using troches, and again, it is multiple doses a day, which can be a little hairy. The benefits, it can be great when you use this just as a PRN, and this is primarily what I will talk with doctors about. Using this as that Friday night or weekend date night when you need a little boost, need a libido boost or energy boost, very rapidly metabolized, rapidly absorbed. Um, the neat thing about these sublingual versions, they don't they don't have a depot effect, so it's literally in and out of the system. Um, Another thing with the troche version of the testosterone, we'll combine that with other ingredients like PDE5s. Um, Again, to kind of get a bigger effect overall. So, like I mentioned, due to the necessity of multiple doses per day, sublingual forms, yeah, for actual TRT routines, it's tough. You get very poor compliance because who remembers to do something 4 times a day, and that will typically lead to not great results or poor outcomes. But as I mentioned before, as a PRN, awesome, really works well. Um, Again, I mentioned the rapid onset, short duration, no depot effect, so very beneficial as far as that's concerned. And here again, some of the other things that we can combine into the testosterone troche if we wanted to, things like apomorphine, PDE5s, oxytocin. Um, you can imagine the benefits of boosting the libido and functionality at the same time. So you're getting desire, you're getting energy, you're getting blood flow, you're getting better erectile response using a single dosage form. So again, some super applications there. And as I had mentioned before, I really was not familiar with the Striant system prior to this, but once I found it and started looking into it, first thing I looked for was why isn't it around? And I think part of it, there was a cost factor, but the other was that it did have that side effect of causing some gum reactivity. Um, but I brought it over to our folks, our R&D folks, so that they could take a look at it. So, this is something that potentially could be a compound for us. Less common options, again, fluoxymesterone, which brand names halotestin, ortestrel, altendrin, and there are others as well. Um, Available strengths 2 milligram, 5 milligram, and 10 milligram, and typically dosed um, for usually just dosed once a day. 5 milligrams to 20 milligrams daily can be dosed or split up as well. The other option, the methyl test, a lot of different brands for that. Testosterone and Android are probably the most commonly well-known method test. Um, 10 and 25 milligrams, and again, dosage range anywhere from 10 to 50 milligrams in any given day. As I mentioned before, the big problem with these is the hepatotoxicity. And the reason is these androgens pass through the portal system instead of the lymphatic system, like the testosterone and decanoate. So we really do see significant increases in hepatotoxicity, and that has led to them, again, really falling out of favor. Oh, in summary, there are a lot of different dosage options for testosterone in general. Everything from the injections, IM and sub-Q, to the gels and creams and patches, pellets, but also the sublingual liquids, the troches, the oral products. So a lot of choices for patients. Um, each and every one of these dosage forms, we've established efficacy in terms of the fact that yes, we are going to get a androgenic response. Um, some are preferred for convenience. Some are preferred for needle avoidance. Some are preferred for scheduling purposes. Um, but again, lots of different viable options. And patients can determine for themselves based on what are their goals of therapy and what fits their lifestyle. Again, one of the reasons that things like the pellets are so popular is because they're kind of a set and forget it. Other people, do well when you're having them on kind of a routine, taking something once or twice a day, and they don't want the mess of the topicals, and they don't want to use the needles. So this opens the door for some of these optional therapies. Um, and again, that will really feed into what the patient's decision is. In general, the oral testosterone, it is certainly efficacious. It's easy to take. It's convenient. It's painless, um, and it can be a very good option for patients and offers them, a way to really improve their quality of life. And it's a suitable choice for a lot of folks. especially folks, like I said, that really don't want to mess with the topical creams or injections. So it's nice to be able to have these options. It's also nice to have the option to compound, simply because a lot of these products are not only dramatically less expensive, but offer kind of a different palette in terms of the benefits. I hope you enjoyed this. I've got all the references listed here, and I will talk with you next month. You guys have a great month. Enjoy.